Dr. Peter Glidden, your steadfast advocate for health. Let's talk about cancer, shall we? It all started with this video that I was in a number of years ago, available on iTube Health. It had 82 million views a number of years ago. Now it's over 100 million. And I simply was telling the facts, the truth, about a study which showed that chemotherapy was only 2% effective. Of course, it created a firestorm in the Twitter universe, with everybody and their brother coming out of the woodwork calling me a quack. So I thought it was time to have an adult conversation regarding cancer, because remember, like the fella said, you're welcome to your own opinion, but most certainly you are not welcome to your own set of facts. Cancer by the numbers. These data, according to the American Cancer Society and the Centers for Disease Control in the United States. In 2016, there were approximately 1,685,000 new cases of cancer, almost 600,000 cancer deaths, which translated to 4,620 new cases of cancer a day and 1,630 deaths from cancer. Now, do those numbers speak to you of a medical system which is winning the war on cancer? It most certainly doesn't, especially when you look at these numbers. Projected new cases of cancer by the year 2020, 1.9 million, 2 million new cases of cancer during the year 2020. Unbelievable. However, it's easy for an unassuming public to be misled, especially when we are entering into the wonderful world of statistics. These data, again, from the National Cancer Institute, their SEER department, that's their Surveillance, Epidemiology, and End Results program. They were queried with the question, what percentage, how many people who have breast cancer, how many women who have breast cancer are alive 5 years or more after the original diagnosis? And the numbers are startlingly positive. 90%, 89.7% of women with breast cancer are still alive after 5 years. People who are unassuming would look at these data and say, oh my God, that's a 90% survival rate for cancer. We're winning the war on breast cancer. Well, not really, because again, there are lies, damn lies, and statistics. Let's drill down on these data a little more closely. These data talk about a 5-year survivorship, which is what all cancer treatments are couched inside of, referenced inside of. It's a 5-year survivorship. And 5-year survivorship is defined thusly: the percentage of people in a study or treatment group who are alive 5 years after they were diagnosed with or treated for a disease such as cancer, even if they still have the disease. So the only thing that's important here is that they're still alive. It doesn't talk at all about the quality of that life or their existence. And it's misleading, because you can still have cancer in this case, and your treatment goes into the record books as a positive outcome, even if you still have the disease that you were initially diagnosed with. And furthermore, it's a relative survival rate, not an absolute survival rate. Most people, completely unaware of these distinctions inside of the wonderful world of statistics, have no idea what this means. Let me break it down for you. Let's say we have 1,000 people in a society who get cancer. 900 of them die and 100 of them live. In absolute survivorship, that means 90% of those people died from cancer and only 10% of them survived cancer in an absolute survivorship index. Now, when we're talking about relative survival rates, we look at the society as a whole and see how many people in that same age bracket died. So let's say in this society, 80% of the general population in that same subset of people die from other things, right? Could be car accidents, could be bullet wounds, could be asthma, could be congestive heart failure, could be anything, right? So if 80% of the general population die from other things, we take the 90% death rate, absolute death rate, we subtract 80% from it, which leads us with only a 10% relative death rate. That means in this example, of the 900 people who died from cancer, 800 of them would have died anyway, even if they hadn't had cancer. Statistically speaking, that means it really wasn't a 90% death rate. It was only a 10% relative death rate, which translates into a 90% relative survival rate. And through the wonders of statistical analysis, we have transformed a 90% death rate into, wait for it, a 90% survival rate. This is what they have done with cancer statistics. But don't trust me, trust the data. In 1975, let me get rid of my smiling face here. In 1975, there were 216 million people who had breast cancer, or 216 million people in the population. People with breast cancer, 226,966. Deaths from breast cancer, 67,928. 2014, the numbers went up. But when we look at the percentages of people in the populations, it was 10% of people in 1975 got breast cancer, whereas 13% got it in 2014. Now, does this mean that cancer survivorship is getting better? No, it means that it is getting worse. But when you look at it from a relative survival rate, you can make the numbers flip-flop, and that is exactly what they did. Again, lies, damn lies, and statistics. As a matter of fact, the numbers are in. These are academic. They are unarguable. These numbers come from Cancer Treatment Centers of America, which, by the way, have some of the best outcomes of any cancer treatment place in the world. Here are their numbers from the Cancer Treatment Centers of America. Small cell lung cancer survival rate. After 5 years, only 4% of people are alive. That means 96% are dead. Ovarian cancer, 33% are alive on or after 5 years, which means 67% have died. Pancreatic cancer, 98% are dead. Prostate cancer, 69% are dead. Rectal cancer, 91% are dead. Stomach cancer, 98% are dead. Colon cancer, 93% are dead. Esophageal cancer, 100% are dead after 5 years. Non-small cell lung cancer, 96% are dead. Kidney cancer, 92% are dead, etc., etc., etc. Now, do these numbers speak to a medical system which is winning the war on cancer? Do they? No, they do not. But look, you don't have to be a statistical genius. You even don't need to know how to spell statistics. All you need to do is look around in your own community. How many people do you know who have been diagnosed with cancer? How many of them are still alive? If they are still alive, has it been more than 5 years? And if they are still alive, what is the quality of their life like? Really simple observational skills that you can bring to bear here while you are being inundated by the propaganda in mainstream media, by the way, which is funded in large part by the pharmaceutical industry. They have preyed upon your good nature. They have taken advantage of your good nature here, because humans, you know, basically are good-natured people. So they advertise children with cancer, right? And adults who have had cancer, who have cut their hair off to be in unity with their brothers and sisters and parents who have developed cancer. They use pictures like this and high-tech industry references to make us feel intellectually inferior. And the socialized message here, brought to you by the pharmaceutical propaganda machine, is if the medical doctors can't figure it out, nobody can. You need to just get out of the way and trust everything that the people in the white coats say, because they are a million times smarter than you are. We rattle our chemo pill bottles to celebrate our health, and it's a tragedy of biblical proportions. Let's look at a little bit of the history of the development of chemotherapy. It was first used, or chemotherapy was developed, from observations of mustard gas in World War II in Bari, Italy. Medical professionals saw that soldiers who were exposed to mustard gas had reduced white cell counts. So in 1943, these guys from Yale, Goodman and Gilman, used it to treat non-Hodgkin's lymphoma, which is a cancer of white blood cells. This was the very first use of chemotherapy used to treat non-Hodgkin's lymphoma in 1943, which begs the question, how effective is that treatment? Not so much. In 2016, there were an estimated 72,580 new cases of non-Hodgkin's lymphoma, and 20,000 people died that year. Not so very effective. But don't worry, it's loaded with side effects as well. According to the National Cancer Survivorship Initiative, this is in the United Kingdom, at least 500,000 people in the United Kingdom are facing poor health or disability after treatment for cancer. Now keep in mind that the cancer may still exist, right? At least 350,000 people living with and beyond cancer are experiencing chronic fatigue, 350,000 sex difficulties, 240,000 living with mental health problems, 200,000 living with moderate to severe pain, around 150,000 are affected by urinary problems such as incontinence, even if they still have cancer. You don't have to be an idiot here to see what's going on. All you have to do is follow the money. But again, don't believe me. This, believe it or not, from NBC Nightly News. Cancer doctors profit from chemotherapy drugs. You probably aren't aware of this, but if your medical doctor prescribes a blood pressure medicine or a heartburn medicine or a pain medicine, they don't get any, there's no financial kickback for them. They have no skin in that game. It's against the law. But not with chemotherapy. Oncologists get a direct cut of the profits from the sale of the chemotherapy drugs. The significant amount of our revenue, and I'm quoting from the NBC Nightly News report, the significant amount of our revenue comes from the profit, if you will, that we make from selling the drugs, says Dr. Peter Eisenberg, a private physician who specializes in cancer treatment. And interestingly enough, it's a very profitable business, with the expenditures for cancer care projected to increase by 27% inside of the decade from 2010 to 2020. More people get cancer because conventional medical doctors have no idea what causes cancer. And yet it's good for them because more people diagnosed with cancer are going to be shuffled into chemotherapy, which is extremely profitable for the medical industry, but has absolutely horrible results. And this is the journal article that I referenced in my initial video that has over 100 million views now. This was a study, the title of which, this was published in the Journal of Clinical Oncology, by the way, in 2004. The contribution of cytotoxic chemotherapy to 5-year survival in adult malignancies. Fancy schmancy doctor talk for how well does chemotherapy work. The results, the conclusion were that the overall contribution of chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia and 2.1% in the USA. The conclusion is, as the 5-year relative survival rate for cancer in Australia is now over 60%, it is clear that cytotoxic chemo only makes a minor contribution to cancer survival. Read through the lines. Chemotherapy is an ineffective treatment for cancer. And the only reason that it is still used is because it is a gigantic money maker. From the proper perspective, everything makes sense. Let's think it through. Your medical doctor may be the nicest person God ever created, but they don't practice medicine. They practice allopathic medicine. By its nature, allopathic medicine is oppositionally defiant. Allopathic medicine attempts to orchestrate a violent takeover of the human body with drugs and surgery. Allopathic treatment of cancer only attempts to kill the tumor. The tumor, however, is not the disease. The tumor is the result of the disease. When you kill the tumor without removing the cause, guess what? The tumor comes back. And when cancer comes back after chemotherapy or surgery or radiation, it comes back with a vengeance. And that is extremely painful, extremely upsetting, and devastating. Since January 1st in the year 2000, chemotherapy, not cancer, chemotherapy has killed 19,790,708 people. Again, you're welcome to your own opinion, but not your own set of facts. These data from the American Cancer Society, Living with Uncertainty, the Fear of Cancer Recurrence. There's the 5-year timeline, and you can see with these data that the recurrence of cancer is more or less guaranteed, for goodness sakes. Let's review and then finish up. We haven't had a free medical market since 1912. The only branch of medicine that cancer research and treatment goes to is the MDs, who have monopolized the medical marketplace since 1912. That's the practice of allopathic medicine. Allopathic cancer treatment delivers academic, statistically horrible results with horrible side effects at a huge profit to the industry with a high incidence of recurrence. For goodness sakes, let the buyer beware. Here are 10 questions that I've developed that every cancer patient should ask their oncologist. You can get a copy of these with a more in-depth video at my website, glidden.healthcare. Just navigate to the free content section on my dashboard. That's glidden.healthcare, right down there. Go to the free content section of the dashboard. And actually, these 10 questions have morphed into 13 questions. There are 13 questions that every cancer patient needs to ask their oncologist in the presence of a witness and a recording device. If every cancer patient simply asks these questions, things may start to change. Here are the top 10 questions, by the way. Pretty straightforward, wouldn't you say? Doctor, what causes my cancer? Doctor, will your treatment cure my cancer? If your treatment won't cure it, what can I expect it to do? And what will the side effects of your treatments be? How are you going to treat the side effects? Can the treatments that you give me cause cancer? What percentage of the treatments that you're going to offer me can potentially cause cancer? How much money will you make from my cancer treatment? How much money will this hospital make from my cancer treatment? And if you could be so kind, I would like the name of 5 of your patients who you treated with my type of cancer more than 5 years ago. I would like to ask them what their experience has been like. As God is my witness, people ask more questions when they buy a car than they do before they engage chemotherapy. Again, let the buyer beware. Knowledge is so much more than power here. It can actually alter the course of your life. I am and always will be, God willing and the creek don't rise, your steadfast advocate for health, Dr. Peter Glidden. So thanks so much for your time. Hopefully, I will see you in the future.
And definitely check out my book, Fake Diseases. It covers all of the major topics that come up, like birth defects, blood sugar problems, bone and joint problems, cancer, autoimmune problems, and more. And it's on Amazon for just $9.99. And the audiobook read-along version is free here on YouTube, and the link for that is in the description of this video. Definitely get yourself a copy of Dr. Wallach's cookbook. This is basically a textbook teaching you everything you know about how to cook without the bad foods, particularly oil and gluten, and all of the other problematic things on the list. This is 300 pages stuffed full of recipes, every traditional recipe that you could think of, and modern dishes without the bad foods that they're usually made from. And of course, make sure to check out our food page, Notus Foods, that's on YouTube, and at Notus Foods on Instagram. We have a lot of content up there teaching you how to cook without the bad foods that Dr. Wallach describes, and Dr. Glidden's 12 bad foods, all of that, all of the rules that you need to know. And we have experienced chefs and bakers who will answer the questions in those inboxes. And I've also published a book in response to some of Dr. Wallach's criticisms, including the major articles that have been written against him on the internet. So if you are a Dr. Wallach fan or a longevity distributor, I definitely recommend having this book in your toolkit.